So, hi everyone. My name is Megan Scanlon. I am the Wellness and Sustainability Specialist here at FIPS. I'll be moderating this next session on health and wellness, where our speakers will explore the human health benefits of spending time in nature and including biophilic design in our built environment. Our first speaker is Vivian Loftness, University Professor and Paul Mellon Chair in Architecture at Carnegie Mellon University. Vivian is an internationally renowned researcher, author, and educator focused on environmental design and sustainability, climate and regionalism in architecture, and the integration of advanced building systems for health and productivity. Vivian?
So I feel like we've been moving back and forth between poetry and science, and I'm going to try to span the two. I'm an architect focused in the area of biophilic and regenerative design, and I have a couple of things that I'd like to sort of convey to the audience and make you better demanders of better built environments. As has been mentioned several times, Eric Fromm coined the term biophilia, and then E.O. Wilson and Stephen Kellert brought it into its full meaning for the architectural and urban community. I'd like to pose a slightly broader definition of what it is we're trying to engage. In addition to direct access to natural living systems and outdoor spaces, we are actually trying to also engage nature within the buildings. And I think a lot of the photographs that Sonia showed you of sort of devoid environments were because they lacked that multisensory quality that we so aspire to. And there is actually a good body of research for why we need this, about why we need access to views, why we need access to the circadian qualities of light, of solar heat, of thermal variability, of natural ventilation, and direct access to nature, so we're physically engaged. There's not very good research on a whole other host of multisensory qualities that we don't necessarily bring into building: the sounds of nature, the smells of nature, the sensory feel, that whole three-dimensional playground. We don't design really three-dimensional playgrounds inside buildings very often. And there's not a lot of research on the importance of natural materials. There's some, but not a lot, on complexity and order, and on the importance of community. I think the WELL standard probably does the best job of trying to figure out what it is the research will be doing, which is looking at each of those variables relative to each of our human systems: our cardiovascular, our endocrine system, our digestive system, the skeletal system, the muscular system. And so it begins to remind us that we need to actually engage nature for each of those outcome systems. So I'm going to pose a couple of questions. One is, how important are views of nature and of community, not just living green things, but also the physical communities in which we live, to human health? The most seminal piece of research, the one that broke open the box of research, was Roger Ulrich's study in Pennsylvania Hospital. And he was able to show that patients in hospital beds that had direct views of green things, of natural settings, where there was actually a level of dynamics, had much quicker recovery rates than those who were in hospital beds that looked at inert brick walls and other buildings, right? So architecture being a relatively inert thing, it shouldn't be, but it is, and nature being very dynamic. And it was, you could actually amortize this. You could put this in a net present value calculation. And even though there's a cost to providing every bed a view of nature, you actually can start to see that the payback is a little over a year. And once you paid for it, it's yours, right? So it's a really cost-effective thing to do. And actually, there are architects that have designed, like Alvar Aalto, built his reputation at Paimio Sanatorium on designing every single hospital room to face the southeast and have direct balconies so that you could wheel the bed right out and you would be in nature, right? So there's some very exciting projects, but not many of them. So we do know that maximizing views, and just another example of research, this one more related to productivity than health, but Heshong Mahone did a study of the Sacramento Municipal Utility District. They were looking at call centers. So like hospitals, there's actually a measure of productivity or performance. And they were able to show that there was 6 to 7% faster handling time of call center complaints for workers who had seated views of nature compared to those workers who were in cubicles, as Sonia showed us, a lot of those devoid work environments in which you're no longer visually connected. So I think we know we need to maximize views of nature. How important is circadian daylight and sunshine to human health? And this is looking at the full circadian variability of color of light, intensity of light, the possibility that sunshine not only delivers heat, but it actually delivers a level of sterilization. It might actually be important to microbial reduction as we start to read about all the viruses that are scaring us. We really want to know, what does nature have to say about this, right? So it's clear that we need to start making daylight dominant, because the research is showing this particular project, which was a follow-up to Roger Ulrich, actually one of his students at Texas A&M, Junho Choi, who came then to Carnegie Mellon to do his PhD. He was able to actually repeat the study in a hospital, and he compared sunlight conditions, both the circadian quality and the intensity of light in southeast rooms and northwest rooms, and found that patient recovery was 26% reduction in length of stay when you were in a southeast room. So any of you guys who end up in a hospital, try to get a southeast room. Because the sunlight is doing exactly what it needs to do, which is it's changing your hormonal response. And daylight is circadian and hormonal. And if you look at daylight, early morning light is blue, late afternoon light is red. It turns out that the blue light produces serotonin, which suppresses melatonin, which keeps you alert, and the red light produces melatonin, which helps you to fall asleep at night. And so it turns out we need this desperately. Now, we could artificially create this with LEDs that are mapping, but it's not clear that there's not just more than color and intensity. There might be more in sunshine that we haven't quite captured yet. So my answer is, let's design around sunshine. One of the most important recent studies on this area is a study that was done by Mariana Figueroa and Mark Ray at RPI. They've been, at the Lighting Research Institute, been studying the impact of daylight and electric light on human outcomes for quite a while. This was a study where they looked at school children and looked at their sleep cycles. And they actually got a whole cluster of school children to put on orange glasses, which cut out the ultraviolet component that went into the eye itself, into the pupil of the eye. And they found that these kids, when they were wearing orange glasses, would fall asleep at least 30 minutes later every night than their peers, and than themselves when they weren't wearing those glasses. And even sunshine through the window of a classroom makes a difference in the sleep cycle of children. And of course, all of you know who've had small kids and trying to get them up in the morning to go to school, 30 minutes of it actually turns out to be a pretty significant impact on how alert they are or how willing they are to even leave the house, right? And so we need to, in addition to celebrating daylight and all of its circadian qualities, we need to celebrate sunshine. And another study that was done here at Montefiore Hospital by Jeff Walsh, who actually is a Carnegie Mellon Bachelor of Architecture graduate, went on to do master's and advanced degrees. He was able to gather data about the amount of medicine that was taken, the medication levels of patients in southeast rooms versus northwest rooms, and found that there was a 22% lower level of medication needed in the southeast rooms. Again, if you're ever in the hospital, you want a southeast room, right? Designing around sunshine is really pretty magical. And, unfortunately, the Genzyme building, which is the photograph on the right by Stefan Banish's firm, is now under massive renovation. I have no idea what it's going to be like, but it is probably one of the most sparkly office environments you've ever seen, because they actually exploded a disco ball and hung it like a mobile in the middle of an atrium, and then actually beamed sunshine with mirrors right down the atrium. And it spins this sunlight all over. It's just magical. Beautiful work environment. How important is dynamic thermal conditions? So we have a tendency, almost all codes and standards in industrialized nations set a flat temperature, actually year-round. So we actually want it to be 72 degrees all the time. And most facility managers are constantly trying to make sure it's 72. Now, in the winter, 72 is fine, because you have enough layers, you're fine. In the summer, for women who are, who are wearing sleeveless dresses and open-toed shoes and enjoying the fact that it's summer and it's 95 outside, and you walk into a 72, you're cold. So we see sweaters, coats, blankets all over the American workplace. If you go to the movie theater, I'm sure most of you know you've got to dress up to go to the movies. What nonsense is that, right? So we're in a crisis here of complete bland. We do this with lighting, we do bland lighting, and we do bland thermal. And yet it may be critical for us to be in a dynamic thermal environment, just as it is critical for us to be in a dynamic daylight environment. And there is a movement called alliesthesia that is trying to figure out how important is it for people to be in dynamic thermal. That includes variations in air temperature, variations in radiant temperatures, variations in relative humidity and vapor pressure, and maybe that is critical to us. Of course, we could spend more time outdoors and we would enjoy that, but if we're going to be bottled up in a building for long, long periods of time, we need to find ways to bring that in. So we need a design to give back temperature control. And again, there is research on this. It's not as big a body of research as in the area of daylight. Some of the early work was done by David Wyan, and he began to look at what temperatures are we most creative in? What temperatures are we best at doing repetitive tasks? And it turns out it matters. That we actually are creative in cool temperatures and do better at repetitive tasks in warm temperatures. And so we need variability for just our daily lives. How important is natural ventilation and increased outdoor air to human health? And this is not just getting more oxygen into the room and less carbon dioxide, get it out of the room, but it's also about what other content is there in the outdoor air that we might need. Now, we're very afraid of the outdoor air because of fine particulates, which we should be afraid of. We're very afraid of the noise that comes with it. But ultimately, outdoor air is often better than indoor air, unless you have a very well-maintained mechanical system. So we definitely need to increase outside air, if only through the mechanical system, so we can filter it, dehumidify it, and provide it at a temperature maybe that's dynamic. There is good research on this. A study by Shaughnessy of 54 elementary schools found that test scores in classrooms that had an increased ventilation rate at 4.5 liters per second were substantially higher than test scores in classrooms. And actually, 14.4%? I should change the color of that font. So we're very clearly seeing that children respond, and there are health data on the importance of ventilation. This is an area where there is a body of research because Europe has not had a tradition of forced air in buildings. They have not been delivering air in every office or every classroom or even hospital rooms. And so now they're beginning to face the need for air conditioning, and they're saying, well, should we do what America does, which is just to seal down the building, blow air? And so they're doing a lot of studies to try to figure out how important is ventilation rate and natural ventilation. One of the most seminal pieces of work was work at Harvard School of Public Health, Joe Allen Pierce and Jack Spangler, where they were able to do controlled experimentation of performance at a whole series of tasks. So this is executive strategic decision making, repetitive tasks, speed tasks, and they found that the higher the CO2 was in the room, the lower the performance was across every task. Right? Literally, it really was compromising people's ability. So we know we need fresh air. We could deliver it through the mechanical system, or we could deliver it through open windows. This is my life's goal, is to make operable windows mandatory in all buildings, right? I mean, I cannot believe that we're taking old buildings that had beautiful operable windows and we're locking them down. We're replacing them with fixed sash. We're introducing mechanical systems. So if any of the talks you heard this morning about connection to nature matter, you've got to fight to keep windows operable. And not just with a little gap like this. I mean, our paranoia about people jumping out of windows is not well substantiated. And 4 inches, which is the size of a baby's head, is not enough to really engage nature. I mean, it's better than nothing. I'll take 4 inches over no operable windows, right? And this is a study done by Preziosi in France. They had a lot of office workers in buildings that were naturally ventilated, and they had a lot of office workers that had now more recently been moved into buildings that were centrally air conditioned and sealed. And they found that there was a substantial reduction in visits to the doctor, in hospitalization, in medical attention, right? So natural ventilation, there's something effective here, even if it comes with pollution and noise, right? So I think, I think we need to anticipate that There's a shift in every school to literally seal these schools, and we've got to begin to reverse that if we are serious about biophilia. How important is increased access to outdoor spaces and community? This is another movement, and I think it's going to be a challenge for us because we are afraid of shooters. And every day or every other day or every week we get another story. And so we're basically saying, we've got to keep our kids safe. Let's do a single point of entry. Let's run everyone through some sort of a metal detector. Well, that means the kids are not racing outside in the middle, between sessions. I mean, I went out, a lot of people went out, breathe deeply in the gardens, come back, right? I mean, it makes a huge difference, that process of movement. And so there's a little bit of research that shows the importance of education, getting outdoors. Some of the earlier work by Tanner in Georgia schools was able to show that the children were performing much, much better at achievement tests if they literally spent a chunk of their time outdoors, and if the outdoors was a very rich environment. It was not just a plot of grass. So I think we need to start ensuring access to nature. I'm going to be down to 2 minutes, so I'm going to, and by the way, I think we're going to try to share this, if nothing else, through the videotape so that people can have access to these data sets. We need to design for active and fit, so that's part of being part of connected to nature, getting people outdoors, providing physical spaces that are rich. And what I'd like to do is sort of end by saying, when in doubt, default to nature. We need to design our systems and buildings to support daylight and electric light, to support natural cooling and mechanical air conditioning, to support natural ventilation and filtered ventilation. So we literally need to run for as long as we can, like 3/4 of the year on nature and 1/4 of the year on assist. And we need to design for indoor-outdoor work and learning. And just to end, this is probably the most beautiful bathroom I've ever washed my hands in. This is in Singapore at a hospital, the KTPH, which is a super deep biophilic hospital. 70% of the rooms have no mechanical conditioning at all. All the outdoor circulation is open air. It's just a beautiful, breathtaking community center where people actually go there to have lunch because it's such a fabulous place to have lunch. And this is the public bathrooms, and you just, when you step out of the stalls, you're sitting there washing your hands while you look at nature. Anyway, with that, I will close. Thank you.